Let me talk about some myths here so you understand. One myth is that the antisocial personality disorder is not treatable. That's sort of a myth because it is very difficult. There is some psychopharmacology that can be used here, and you're really not treating the personality disorder as much as you are treating the aggression. You're mellowing them out some. Non-psychopharmacological treatment methods, cognitive therapy, behavior therapy, group therapy, family therapy, which are talking therapies, I have to tell you, it's not the best prognosis. Can they get better? Anything's possible, and they can get better with time, but compared to treating someone that's highly motivated, like let's say they have a phobia, the prognosis for treating a phobia, an irrational fear that's been attached to some object or situation, prognosis is excellent. Prognosis here, not so much. In fact, some of these clients can get worse with therapy. Why? Because the therapist, in an effort to coach and improve the conduct of the antisocial personality disorder, will model for them what empathetic behavior looks like. They'll teach them how to reflect feeling, how to reflect appropriate emotions. And the psychopath, the antisocial personality disorder, will go to school on that. They go, okay, I didn't know how to do that before, but now I'm going to be a little harder to spot because I know at least how to mimic empathetic behavior. So I can hide in plain sight now because somebody's taught me how I'm supposed to behave. Now, they may not know anything beyond what you've modeled for them, but that can cause them to be a little harder to detect. And let me show you how this works. Somebody that has the capacity for empathy, someone might come in and they're 15 minutes late for work and they say, hey, sorry I'm late, but as I was leaving the house, my dog got out of the gate and ran into the street and it got run over and killed. Well, a normally functioning, healthily functioning individual will do what we call empathetically reflecting feeling. So they're likely to say something like, oh my gosh, you must feel terrible. Here, sit down for a minute and then talk to me. I'm so sorry. And they're thinking how they would feel in that situation. And so they comfort the person. They're sympathetic, but they're also empathetic. They can relate to how the person must be feeling. And so they'll say things like that. Oh, you just must feel terrible. I am so sorry. And, they might inquire, were you alone? Did you have to deal with this by yourself? Oh my gosh, that's terrible. A psychopath, someone with an antisocial personality, doesn't know how to relate at that level. They don't understand intimacy. They don't understand empathy. So what they're going to do is reflect content, not feeling. So the same person would come in and say, sorry, I'm late, backing out. Gate was open, dog ran the street, got run over and killed. The antisocial personality disorder say, really, what kind of dog? Chihuahua. That's too bad. They don't know how to put themselves in that person's shoes and reflect feeling. All they know how to do is reflect content. Oh, dog got run over. What kind of dog? Kill it outright? Huh. Did it squeal? Huh. That's all they know how to do is reflect content, not feeling. And so if they get into therapy and the therapist does what I just did, which was to model how an empathetic person would relate, they go, oh, okay, I got that now. If somebody suffers a loss, a key phrase is, oh, you must feel terrible. Have a seat. Tell me about, were you alone? They go, okay, I got that. I got that. So now something like that happens. They do that. And if that carries the moment, the person that suffered the loss might walk away and say, oh, he was so kind. He was so warm. It was really nice. And that would cloak the fact that he was not genuine because he was taught some skills to hide that. So do they get better? They can, but the prognosis is not great, and sometimes they get worse. Myth number 2, antisocial personality disorder and avoidant personality disorder are the same. No, they're not. They're not the same at all. They're very different. A person with antisocial personality disorder has trouble with relationships because, as I just said, they can't relate at a feeling level. The person with the avoidant personality disorder, which we haven't talked about yet, they avoid intimacy because they're just certain that they're going to be judged and rejected. So they don't want to put themselves in that situation because they fear that it's going to go badly. So the antisocial personality doesn't know how to get close or be intimate. The avoidant personality doesn't get close enough to even be in that situation because they know they will fail. Myth number 3, antisocial personality disorder is an excuse for poor behavior. No, it is not. These people know right from wrong. You know, one of the things that I had to deal with in court work was sometimes helping the court to decide if the behavior that the court or the jury had to sit in judgment of was an irresistible impulse or an impulse not resisted. Was it an irresistible impulse or an impulse not resisted? And there is a big, big difference. An irresistible impulse means the person was out of control and had no choice, like blackout anger. An impulse not resisted is they just had an impulse and made the choice not to resist it. Antisocial personality disorders know the difference between right and wrong, and they just don't care. They don't have the ability to predict how the person's going to feel that they're victimizing. They don't have the capacity to feel remorse, so they just don't care. They'll choose to go ahead. They know the difference. They just go ahead. Now, again, these are people that can be very charming. They can get close to you. Short term, they can come across as really confident. A lot of con men have antisocial personality disorder. They come across as very confident. You know, we forget that con man is short for confidence man. They instill confidence in others because they come across very confidently. There's a fake charm. There's manipulativeness. There's a dishonesty. But they hide it. They are ruthless. And the more you get out on the ends of the continuum towards this really cold-blooded psychopaths, the worse it gets. Now, why am I telling you all of this? Because these are dangerous people. They will charm the pants off everybody in the room. They disregard your feelings. And when you look at them, once I've gotten you sensitized to this, where you look for these red flags, you'll look at them and say, they don't even believe what they're saying.